I'm Dr. Carla Torres-Zegarra. I'm a triple board certified pediatrician, dermatologist, and pediatric dermatologist. I work primarily at Children's Hospital Colorado at their main campus in Anschutz, but I also work at CU Medicine Dermatology at Montview and at the Veterans Hospital here at Rocky Mountain. I wanted to become a doctor because when I was a little kid, I always looked up to my godmother, who is a pediatrician. She was always the one that people asked questions about whenever we had a new baby coming in the family, whether it was a cousin or a baby's friend. But most importantly, when I turned about 7, I was just very close to my grandfather, who lived at our house, and he had a lot of doctors. He had a complicated medical history and was at that time back in Peru, was getting doctor visits to the house. And there was this one doctor who was very particular about not allowing me to be in my grandfather's room when he came to examine him. So he would always ask me to leave, which I didn't like at all. And so one day, that doctor asked me, kind of looking down, I remember exactly where this was in my parents' house, where he looked down at me and said, "What do you want to be when you grow up?" And I looked up at him and I said, "I want to be a doctor." And he said, "Why?" And I responded, "I want to be a doctor so that I can treat my grandpa better than you do." And he looked at me, and it was like in front of my parents and family. And I'm sure my mom kind of was like, "Oh my God, what has she said?" And that doctor, interestingly, ended up being my teacher in medical school. He's a nephrologist, and he still remember that time. And he was the first one that I called when I entered medical school, and the first one I visited after I graduated from medical school. As a pediatric dermatologist, my vision is to have a patient in my clinic that leaves the clinic satisfied with having treated what they want to be treated. And why I say that is a lot of the time, especially in the teenage years, we have patients that are kind of dragged by family members to come here and that may not be as engaged as parents or caregivers are in starting a treatment. So I really want to partner with that teenager to make sure that whatever decision we make in terms of a diagnostic and treatment plan aligns to what they want. In terms of younger families or treating little babies, my goal is to comfort parents, whether they're new or in their fourth child, in terms of giving them reassurance that they're in the right place, that they're going to get the best care they possibly can, and also to help them be part of the patient's evolution along the way. I particularly like, one of the things that I like the most is taking care of patients that speak my mother language, which is Spanish, so I can provide with them direct communication without having to use an interpreter, whether it's in person or through a machine. And so that's definitely the highlight of my practice, because I feel like if you are interacting with a doctor, you're already in a difficult situation or in a stressful situation, coming to the hospital and bringing a child that in your eyes could be very, very sick. And so I think that having the ability to communicate with my patients in their own preferred language brings down that wall of stress and just allows me to be able to provide the best care that I can, and also to have better outcomes with my patients that clearly understand what I'm trying to convey to them and that I can clearly understand what they need.